Hi, I'm Laura Archer and my partner is Brianna Lackey, and we are doing Implementing Change project for Hospital Acquired Pressure Ulcers, and we're going to discuss that in depth today. I'm doing part 2. Brianna Lackey, she has experience as an OR nurse, and I have experience as floor nursing and also with post-operative nursing in the PACU. So we have a combined experience and knowledge with different types of pressure ulcers that can occur in the hospital. So I'm going to start off with a picture today, and I'm going to show you. So in this picture, the pressure point is the head, the shoulders, the bottom, and then back of the heels. It's showing that the bone is pressing on the blood vessels, cutting off circulation when placed on a hard surface. So it's very important on hard surface that we put foams and pads under the patient to protect their skin. When should we intervene? At the first stage of seeing any kind of redness on a patient's skin, you should press it down, see if it's blanchable. If it's blanchable, then it's a stage 1. Something's got to be done right away. Or if they look like they're at high risk, poor circulation, incontinent, elderly, then go ahead and take measures and be prophylactic on preventing a pressure ulcer. So you can apply barrier cream, and you can also put foam dressings on pressure points like heels, bottoms, backs, wherever a wound may occur. And if you see the redness, go ahead and put a foam down there with the barrier cream. If they have tubes and drains or any items like caps or medicine that may drop into the bed, anything that might be under the patient, you need to make sure that it's not under them. Make sure the tubing of a Foley is on over their leg, not under the leg, because it can cause a pressure ulcer by pushing that bone on that blood vessel. So it's very important to avoid. Minimal linen should be under the patient, just the bottom sheet and a pad. It helps with the patient not sweating as much, and it helps if they're incontinent as well, so they're not sitting in all that wet linen. Dermatherapy linen is used at Cone Health, and this is something that they invented to help protect the skin. It's helping prevent actual pressure ulcers from forming, but also it helps when their patient is incontinent. So it's definitely something that has improved the hospital-acquired pressure ulcers at Cone. Head of the bed should be lower than 30 degrees or at 30 degrees. The higher it is, the more pressure is being put on the patient's bottom. And this could cause pain and also cause the pressure ulcer to form because the bone is pressing on the skin. And then increase protein intake. Protein helps with healing, so we definitely want to encourage that in their diet. And you want to ambulate the patient. Don't let them lay in bed all the time. It's important to get them up and moving so that way their body isn't always having pressure placed on it. I have another photo for you. So in this photo, stage 1 is when it's red and blanchable when you press on it. Stage 2 is when the pressure ulcer goes down into the epidermis. Stage 3 goes from the epidermis into the dermis. And then stage 4 goes the epidermis, dermis, through the fatty tissues and blood vessels to the muscle and also sometimes the bone. So to identify the area of support and resistance. As a leader, the best plan to help engage employees is to reward them and also praise them for accomplishing this change by decreasing the hospital-acquired pressure ulcers, by participating in the training, and by being excited for it. Praise the little things. Training could be mandatory modules, which would help continue the education and learning, and a poster board for visuals for people who are visual learners. Formal power. What is formal power? A leader should use this by using their authority, and by using that, they're holding the staff accountable, making due dates for the training and due dates for the modules, making sure everybody attends and making it mandatory, reiterating what they learned in staff meetings and huddles on a daily basis. This will help encourage them to make the change and also help them remember what the change is. Informal power, this is the more fun side. And in informal power, you could praise, reward them, like I mentioned earlier, make the training fun, provide free food, make them want to attend, and make them excited about this change. So it's kind of the softer side of the leader. Who will be affected? Patients, of course the patients. Their outcome will become poor, so we want to definitely avoid the hospital-acquired pressure ulcers. Nursing staff is affected, environmental services, health care workers like CNAs and other people in the other departments, housekeeping services, nutritionists, physicians, the directors and assistant directors, the managers over the whole hospital, and wound care nurses are also affected. The movement. So in the movement, we set a time frame, me and Brianna, and we decided that May 1st, 2020 to August 1st, 2020 would be the time. And then all statistics will be performed every 3 months, and we'll see the numbers hopefully decrease. But if they begin to rise, then we'll have track of it. Have the strategies that you use as a leader, have someone audit the charting, and that should be the leader that does that. Every 2-hour turns need to be checked to make sure those are being charted. Daily baths need to be done. Pericare needs to be done. Make sure that dermatherapy linen is always stocked in every day and that you never run out of it so patients aren't sitting in wet linen. And teach proper skin checks. The nurse should do a skin check on every patient every shift. And if a new patient comes, then 2 nurses need to check the skin to make sure that nobody doesn't miss anything. So we make sure that we didn't cause their pressure ulcers. And if it was already there, then that needs to be noted. And use prophylactic foams. Make sure these are stocked on the floor. Make sure that nurses are aware and trained for these. Make sure that they're using them and charting them. And also during surgery, make sure that foams are placed under the patient's pressure points before the surgery begins. And what we would do, me and Brianna as leaders, we would prevent pressure ulcers from occurring in the hospital by providing a slideshow presentation, a poster for visual learners, pressure ulcer display models where they can see how deep the stages can go and what it might look like so they know how to rate the stage as they're charting. And create modules for all the staff to complete. Implement the change. The leader would take charge of this education, announce to, and email the staff. You want to email them daily and announce to it in huddles and meetings to make sure that everybody is aware of when the education is and when they're going to have to train. And set up and make sure that the training has all the materials that are needed before it begins. You can hold a training and a meeting with a PowerPoint, interactive lesson, a quiz with prizes and free food, have handouts that are very visual to help continue the education, and bring foam models in the different stages of the pressure ulcers. There's going to be people who are going to try to resist the change. So strategies for overcoming resistance. Offer bonus pay when the numbers decrease on hospital-acquired pressure ulcers. This will help motivate them more than anything. Motivate the staff, educate them on why the change is occurring, because if they don't know why, they're probably not going to want to help out. So if they know why and the purpose, then everybody's going to be on the same page. Turn the change from a negative to a positive. Always talk about it in a positive attitude. Reward them when positive changes occur. Listen to input at all times. Take in the staff's words and take it into consideration. Make them feel valued and important. Try to get everyone on the same page is going to be the most important goal. So evaluating the change. We're going to gather statistics on how many hospital-acquired pressure ulcers have occurred from May 1st to August 1st of 2020. Barriers. There's going to be barriers. So certain patients may have a poor outcome affecting their circulation, so they're already going to have a high risk of getting a pressure ulcer. Staffing needs to be adequate. If there's not enough nurses, they can't do the every 2-hour turns, they can't do the proper wound care, and the patients aren't getting enough attention that they need. You need all the staff to be on board and compliant. Certain surgeries may not allow the patient to be moved or turned. So in that case, knowing ahead of time that this surgery may last 10 hours, then the patient needs to be put on foams, even if the surgery only lasts an hour. Put every pressure point needs that foam under it. since it's a hard table. And the change will allow better outcomes for the patient. Patient satisfaction scores are going to go up. The hospital is going to have a higher amount of recommendations. Bonus pay could occur. Rewards for the hospital could happen. A magnet status. Hospitals have less out-of-pocket costs for hospital-acquired pressure ulcers. And this will help the hospital overall because the Medicare and Medicaid is not going to cover it if we caused it. And refreeze. So refreeze provides support and encouragement for your staff and throughout the entire process. Provide recognition, put it on the wall, their rates going down, praise them, reward them, make learning fun. And also show enthusiasm over the topic, because if you're enthusiastic about it, so will they be. And bonus pay for the decrease in the numbers, you want it to stay or be below the goal. And incorporate room care nursing, advising them whether they need to do a certain type of dressing over another one. They can reach out to the wound care nurses. And that's all I have for you today. Last page is references. Thank you so much. I hope you learned something.